Thanks for coming out this morning. What we're here to do this morning is to launch the TV ads that we have put together to kick off the campaign opposing privatisation, not only in our schools but hospitals as well. We're here to launch the TV ads, which you'll be able to see from Tuesday night on Channel 10. The Barnett government have announced a program to privatise as much of the public hospital system as they can. They have announced already that they will privatise the new Midland Hospital when that is built. The plan is to close Swan District's hospital and replace that with a new purpose-built hospital in Midland. Colin Barnett has already announced that the new Midland Hospital will be a private, operated by a private company. The Fiona Stanley Hospital, which is being built up the road, that's going to be the major teaching hospital to take this state into the 21st century. A large number of the services at Fiona Stanley, this Liberal government wants to have operated by a private company. But every new hospital that they're building, they're saying is going to be substantially run by a private company. And we know once they've done that, that they'll then come after the existing hospitals like Fremantle, like St Charles Gairdner Hospital, like Royal Perth. And why are they doing it? Not because they really believe that it's going to create a better service. It's more because they have such a negative attitude to the people who currently run our public hospitals. The Barnett government just have this view that anything done by the private sector is better. And we know that's not true. The public know that private companies running public hospitals, they know that they'll be there just to make a profit. We know that with a public sector workforce who are there, one, because they love the work, and two, because they're dedicated, three, because they really believe in the public system. We know that that creates a better public hospital system. We know from past experience that private companies will just come in and do it to a budget, do it to a price, and cut corners, and the people who will suffer the most are the public. We have decided that we're going to fight them. We are going to take this issue to the public, because we want to take this issue straight to the public, because we believe the public are on our side. We've got the Labor Party, the opposition, to put a bill into Parliament, a private members bill, which opposes privatisation. They want to do it under the radar. We want to get them out in the open declaring their hand. So having a bill in Parliament where they actually have to stand up and say what they're going to do on privatisation is a very important tool for us. So get involved in the campaign. It's very important that we take this fight up to the government. We really need you as the members to get on board because without your involvement we're not going to be successful.
Thanks, Dave. Well, folks, this is a really important campaign. As Dave said, last week in Parliament we introduced the No Privatisation of Hospitals and Schools Bill. That's an important initiative. It gives us something to rally around. But putting bills into Parliament is relatively easy. The hard work is changing minds and creating awareness out there in the community. People hate privatisation. You just need to shine a light on it so that they know what's going on. So this campaign is really important. It's really important to make sure that we protect your jobs. That's obviously a really key issue. But there are other reasons why this is important. And that's because we know that public hospitals, when they're run by the public sector, are good hospitals. And that's what we're really trying to protect. We're trying to protect the health system of all West Australians, and while at the same time achieving a really important task, which is protecting your jobs. So thanks very much for the work you've already done so far. The fight has just begun. This government runs scared whenever they see people angry, whenever they see people organised, whenever they see public opinion starting to turn. So what we're going to be doing is campaigning, taking that message out into the airwaves, taking that message out into the newspapers and into the television news. And I'll be working really closely with Dave at the LHMU, Chris and Dan at the HSU and the other health sector unions to make sure that we get that message across. We turn this not from just a political campaign but into a community campaign. It's It's a community campaign to protect jobs, to protect our health system. It's an important campaign, and it's one that I'm going to be working day and night between now and the next election to make sure that we hold this government to account. Thanks very much for your work, and I look forward to working with you in an ongoing manner from here on in. Cheers. Thank you.